Welcome, colleagues. Thank you for being part of this discussion in the UN World Data Forum on Persons with Disabilities. My name is Facundo Chavez. I'm the Human Rights and Disability Advisor of the Office of the High Commissioner for Human Rights, and I will be moderating the session today. I'm starting off with a few housekeeping items. This event will be recorded and shared later and posted on the World Data Forum's website. International sign interpretation and live captioning are provided. The international sign interpreter is spotlighted, and the captioning is available by clicking on the closed captioning box on the bottom of the screen, and also available in a separate link that has been shared in the chat box. Presenters and the moderator will use their cameras while presenting, but for others, we ask that you turn off your cameras. We are not using PowerPoint presentations or visual materials during the event. We'll be sharing relevant links throughout the event, so please follow the chat box. Throughout the event, please ask questions by writing in the chat box on the bottom of the page. If we are unable to answer your question for any reason, please send us an email and we will follow up. The email will be posted in the chat box as well. So thank you, colleagues. Thank you very much for being part of this conversation today. For us, for the Office of the High Commissioner, it's a great moment to be participating in this forum, mainly because we are drafting our first report on the human rights-based approach to data, looking at the Convention on the Rights of Persons with Disabilities, Article 31. And we've been collaborating with a number of many of you that will be participating today for the past years to promote data disaggregation, data collection of persons with disabilities, the promotion of data collection through community-based processes, the protection of data in aspects that are related to privacy, both for data protection as well as for statistical data protection or statistical confidentiality. And of course, dissemination and data use are going to be main messages in our upcoming report. Hopefully, many of your contributions will be reflected in that report, and I'm thanking in advance to many of you that have already contributed to our work. Today, we have an amazing panel that will be discussing these issues some more, and hopefully can expand with the good examples of how we need to move forward, how to improve data collection, how to improve data use in the coming years. So I will give the floor first to our first speaker, that is Ms. Liza Beretti, Director of Operations in the Pacific Disability Forum. Liza, you have the floor and 7 minutes. Thank you. Liza, are you there? Okay. I don't see Liza connected. So we will move to the next speaker in the interest of time. Jose will be our next speaker, Jose Viera, who is the Chief Executive Officer at the World Blind Union, and he's also the Global Disability Summit Secretariat Senior Management. Jose, you have the floor.
Thank you, Facundo. Good morning, good afternoon, everyone. Thanks for the opportunity to bring some of the work that we are doing with regards to the topic that you introduced, Facundo, which is, I believe, one of the key elements looking forward when it comes to inclusion of persons with disabilities, and that is the human rights approach to data. So I'm really glad to share with you some of the results that we have from some activities that we have conducted in previous years. If you remember, or at least some of you may have remember, last year we launched the disability toolkit from the Stakeholder Group of Persons with Disabilities. The disability toolkit, sorry, the data disability toolkit. It was the result of a joint effort by the Stakeholder Group of Persons with Disabilities, the International Disability Alliance, and the CBM Global Disability Inclusion. And actually, the data toolkit that we launched last year and is already being used in different ways, which I will speak about that in a minute, was basically the outcome of a long discussion that we have been within the working group that we have under the Stakeholder Group of Persons with Disabilities regarding data. So what I'm trying to say with all this that data is not something new to the Stakeholder Group of Persons with Disabilities, but rather a fundamental component of our advocacy work when it comes to the SDGs. Actually, long time ago, we created this working group on data that actually many of the distinguished panelists in this room are part and actually active members. So, as I said at the beginning, in 2021, we are happy to share that the data toolkit that we launched last year is being used already in different ways. And I would like to present at least one clear example, but also talk a little bit about how we continued working in making the data toolkit an accessible a training package or advocacy document. So together with UNFPA and several OPDs, including the Pacific Disability Forum, the ASEAN Disability Forum, CBM, Global Disability Inclusion, and the International Disability Alliance, we are doing a project in the Pacific region to actually see how we can address the issue related to data from a human rights approach and using the data toolkit that we launched last year. And if you see, the project has like main three pillars, one of which is actually to better understand through a mapping exercise what are the needs of OPDs when it comes to the discussion related to data. And again, this is very much connected to one of the reasons that we thought it was needed to address through this data toolkit. In other words, the data toolkit aimed at discussing how OPDs can engage in the discussion around data. So we are really glad and pleased to see that through this project with the UNFPA colleagues, we are already starting putting in practice this idea of mapping the needs of OPDs when it comes to engaging in the data discussion, along with understanding better what we need and how we can better equip our OPDs so they can advocate for more data and disability. We understood that we really need to produce training packages for organization of persons with disabilities, but not like traditional training packages where we have one expert coming into a room and presenting what the knowledge is, but rather like a more bottom to top approach where through case studies, through practical experiences, OPDs can better understand what are the tools they can have when it comes to advocating for the inclusion of data and disaggregated data for public policies and programs. And the third component of this quite innovative project is like a very detailed and effective communication strategy around why it's important to address issues related to data and disability. And I think this last pillar again speaks to another reason that we had for making this toolkit a practical tool, and that was how we can make even more visible the need for data and disability, and what are the benefits and the positive outcomes of having more data regarding disability included in different programs. And actually, yesterday we were part of a high level session in this World Data Forum, where one of the many outcomes was that we really need to ensure that data around people with disabilities is across all sectors, that it will never be sufficient if we only concentrate the issue related to data and disability in one specific ministry or in one specific work stream of the National Statistics offices, but rather trying to see how we can mainstream data when it comes to public policy and programs. So I think with this clear project that I just presented, we are not only making the data toolkit that we produced last year lasting change, but at the same time, we are bringing OPDs to the table and hopefully opening doors at the national level for organizational persons with disabilities to be included in the discussion. But for the for just to conclude my first intervention, a one of the questions that we always receive is, so we are very clear on the need for producing data regarding persons with disabilities. But what do we do with the data that we generated? What can we learn? What are the different uses that we hope governments can implement when it comes to data and disability? And I really want to share another experience carried out by the International Disability Alliance, and that is the survey on COVID-19 and persons with disabilities. And actually, one of the most interesting pieces of this study that the International Disability Alliance carried out, which was, of course, a combination of quantitative and qualitative data, mainly driven by organization of persons with disabilities, and with the overarching goal of hearing what persons with disabilities wanted to say, was actually to better understand what were the challenges that people with disabilities faced throughout the pandemic. And I don't want to go into details because I'm sure pretty much everybody in this room knows what people with disabilities faced throughout the pandemic. But if I have to highlight the mental health issues that persons with disabilities have been facing, the lack of inclusion in national emergencies responses, the lack of accessibility to health care systems, and something that is a very new concept, which we always try to support, is how we can ensure that the community in which persons with disabilities are better equipped to promote inclusion of persons with disabilities. In other words, what are the community support services that have to exist for persons with disabilities to access to health services, to access to employment? What are the preconditions for the inclusion that we always aim at creating for persons with disabilities? And actually, the COVID-19 report that I was presenting about very much speaks to those needs. And basically, relying on the data generated, I think we are better prepared for the advocacy piece that comes ahead of us when we need to work with governments. Facundo, in closing, I really want to highlight again that we can clearly see after the launching of the toolkit last year, we are seeing a clear implementation of the toolkit through the project with UNFPA, and we are pleased for that. And the survey from IDA clears recommends us that there is much to be done, but I think we are slowly progressing. Thank you.
Thank you, Jose. That's super interesting. Thank you for bringing the community support perspective, and also to address disability data gaps and how we can build on the resources that you were presenting, disability data advocacy toolkit and OPD-led surveys, so we can foster partnerships and increase investment, build capacity, and most importantly, make disability data available and a priority for everyone. Thanks, Jose, for that. Sorry, Garinan, for speaking too fast before. And let's now go back to Leisa, that it's now ready to present. She's the Director of Operations, as I said, in the Pacific Disability Forum. Leisa, you have the floor.
Thank you so much, and a very good morning to each one of us who are joining in. And it's a privilege to be part of this event, and also to share the efforts of the Pacific Disability Forum and its members here in the Pacific in terms of data advocacy as part of our ongoing work. Maybe to start by saying data for us is almost like the currency for the transaction in our disability advocacy efforts. For OPDs and advocates, we have to produce the numbers to move the money, the funding for policy and program intervention and implementation, for the participation, and also for the removal of barriers, inclusion of persons with disabilities. In terms of data collection through OPDs in the Pacific around COVID, COVID now, response pre, some of us are still in the COVID response, and the efforts, we continue to have this the advocacy around the inclusion of the Washington group short set questions in data collection with governments or with partners. PDF started with this work, I think, for the last 5 years, working alongside partners and organization who is responsible to collect data at the national level through censuses is where we started off, and that's the work that we've been at for the last 5 years to date. And since then, for every Pacific Island government or country that has held census in 2015, have used the short set, the WGSS, in their census. So it has been quite a journey for us as an organization of persons with disabilities around the advocacy for the use of all the 6. At times, we are told you can use 4, or we are not only allowed to use 1, but I think with the support of partners, and not only from OPDs, but the support of partners that we work with, whether it's a regional organization or international NGOs or the UN agency that we work with, we're able to come through very clearly on the message that, we cannot use a 4. Some of us will be left behind. We will have to use all the 6. It will be like a baseline for to identify the most at-risk population of persons with disabilities. And if you want to know the specifics of all the others, then there are other surveys and other questions, extended questions on children in particular, that is also available. I think for us in the Pacific, for the purpose of this event, just to share our efforts around the use of the Washington questions, really. So it's very important that we, at the national level, for at the census level, it's very important that we collaborate and forge partnership with organization, government that is responsible to collect data. So it started with UNICEF in the Pacific, which is based here in Fiji, and also with the regional organization responsible for data and statistics in the Pacific. Around, where are we? It's now SDG, post SDG 2015. Would really love to see that we are reflected better in your data collection system, and hence, there's a tool that is available that you could use, and so thankfully, thanks to the Washington group and also through UNICEF, you were able to to be part of some of their capacity building training on the tool itself, that we were able to bring back and take back to our members and the countries. So because first we will have to build our capacity on the tool itself before we go and advocate for it. What does it do? What it can do? What it cannot do? And what can we do with the information that is produced out of it? So the collaboration at the regional level, because we are a regional OPD, and then collaboration also at the national level with the National Statistics Office or the Bureau of Stats in some of our countries, to build this partnership and to promote the use of the Washington group short set that is recommended for census at the census level. So what we had to do once we have that partnership and the, uptake in terms of the use of the Washington group questions, as a regional OPD, we go back to build capacity of OPD at the national level. For example, if it's a census in Solomon Islands, which is in 2019, we go back to build capacity of OPD to understand the tool. So if they advocate and work with the National Statistics Office, they are better placed, to share, to explain what the tool can do, what the tool cannot do, and what it can produce. Also to be part of, enumerators training, a part of enumerators for data collection itself. And this has been, I think for us, it's one of our successes, working with National Statistics Office through our regional partners with UNICEF in the Pacific, and also the Regional Statistics Office that we have. And then not only at data collection, but to ensure that after census, so what do we do with the data that we have collected for persons with disabilities? So we continue to work with the partners that I had mentioned to produce a disability monograph, a specific chapter to talk about disability across thematics, whether it's education, whether it's a living condition, or whether it's health, or whether it's a wash services. All of these are reflected specifically in the disability monograph. So the last 5 years, almost 10 countries, everybody that have used the tool. At least we have a number of countries who have produced a disability monograph, and we continue to advocate and work with partners to advocate for the development of a specific disability monograph or chapter or report for persons with disabilities out of census. And so out of those, not only that we have produced the disability monograph, but then, okay, the data is now available. So what do we use it for? A few of the countries who have produced disability monograph have used, data to as a baseline data to develop their first ever disability allowance. And this is where it has been very useful. Countries like Kiribati who've had their first disability allowance in the past 2 years out of the disability monograph. And there's countries like Tuvalu who have also used data out of censuses with the use of the Washington group questions. So I think it's very important capacity building for OPDs and working with partners. So we not only stop at data collection, but also to produce a disability report or disability chapter out of census, and how that is used for policy intervention, policy design. Very important, disaggregated data has to be at the center of policy design and decision making in order to remove barriers and allow participation of all persons with disabilities. Data is at the core of any policy component. So I think it's very important. I had mentioned earlier in the beginning, for us, it's like it's a currency for transaction, disability advocacy efforts. We produce the numbers to move funding, move money for policy intervention, policy design, and programs for the inclusion and participation of persons with disabilities, and removing the barriers for all of us, all persons with disabilities. So I think I will stop here and take questions later on. Thank you.
Thank you very much. Thank you very much for your intervention. And I will ask the colleagues, I'm sorry, to keep their presentations adjusted to the time. And so everybody has the time to present on the work that they are doing. Neda Jafar is our next speaker. She's the head of a Statistical Policies and Coordination Unit in UN ESQA. So Neda, thank you very much, and please, you have the floor.
Thank you very much, Fernando. ESQA, in collaboration with the relevant stakeholders and partners, has been implementing a disability statistics program since 2016. This program aims to improve the production and dissemination of officially comparable and harmonized statistics on persons with disabilities, to leave no one behind. This is accomplished by implementing regular rounds of data compilation from countries, assessment of data collection tools, i.e. the questions used in the questionnaire, and computation of disability indicators. The outcome at national and regional levels have been increased production of analytical publications, guidelines, and policy briefs. At ESCWA, we produce the regional guidelines on how to apply the Washington Group standards and the 115 framework indicator that links the RBT to human rights to SDG. We also, one of the outcomes is improved dissemination of disability data and indicators. The ESCWA interactive data portal and dashboard includes around 50 indicators on population, education, and work. The number of indicators and policy areas are expected to increase this year of data collection. This work also contributes to the Secretary General Disability and Development Report. Through the disability statistic programs that ESCWA implements capacity development activities at the country and regional levels and holds interagency and expert group meetings to develop guidelines, toolkits, including sharing of good practices. ESCWA also has a special group named the Casablanca Group, comprised of experts from the National Statistical Offices, established in 2017 as an outcome of the joint ESCWA Washington Group workshop in Morocco. The group aims to develop and improve statistics on persons with disabilities at the national level. Countries of the region and ESCWA regard disability statistics as an important area of work. Countries have been compiling data through censuses and various household surveys like MIX, labor force surveys, household income and expenditure surveys, and VOW, health and poverty surveys. Data collection has increased in the past years. Almost all of our member states have collected disability statistics in line with Washington Group short set of questions on functioning. The COVID pandemic has affected all, especially persons with disabilities, reflected in the health risks posed by the virus and in weak social protection systems. More than before, we urgently need to compile data, detailed data, and on regular basis, and to leave no one behind. For this reason, this year, ESCWA initiated through its program of work to develop a regional standalone questionnaire and produce comparable data and in-depth information on persons with disabilities that would directly respond to the 2030 Agenda for Sustainable Development. A standalone survey will allow us to further investigate difficulties beyond the short set of questions and beyond the prevalence and socioeconomic characteristics of persons with disabilities that are usually compiled through the short questions or models linked in a bigger survey. It will allow us to identify the needs, barriers, and daily challenges in respect to types and severity of the difficulties and the circumstances that are not common to all, and answers policy questions and identify suitable inclusive interventions. Standalone questionnaires will allow us to expand our information, have better understanding of time use, environmental factors, access to information, use of personal assistance, assistive products, and facilitators. It will also provide us with vital information on healthcare utilization and responsiveness of the healthcare system and source of income. It will also shed light on education needs and reasons for not going to school or work. These are all information that are not available within the regular survey. An increasing number of countries have been implementing disability standalone surveys in the past years due to the growing demand for data and information. Since 2011, 5 Arab countries, Saudi Arabia, have implemented standalone surveys on persons with disabilities. Building on ESCWA initiative and in collaboration with the Washington Group, will organize an interagency expert group meeting to discuss development of this questionnaire with national statistical offices, NGOs, and other regional and global partners and stakeholders, and share good practices. At present, there is still a huge gap in data and therefore of knowledge about persons with disabilities. ESCWA, in collaboration with its member states and partners, are working to further develop and implement tools and guidelines to bridge this gap. Thank you very much.
Thank you very much. Experience from your side, and I'm sure that these guidelines and documents that you have provided are very good, and we are of course portraying your work in our report on data, looking at the amazing collaboration that you have promoted and partnership building that you have promoted through this work with persons with disabilities themselves and national statistical offices in the region. Thank you very much for sharing that experience. Anderson Gitonga is going to be our next speaker. He's the Chief Executive Officer at United Disabled Persons of Kenya. Anderson, you have the floor.
Thank you very much, Facundo. Please confirm that you can hear me. Can you hear me?
Yes, we can hear you perfectly well.
Thank you. Thank you very much. So in terms of the situation in Kenya, the COVID-19 pandemic presented an urgency for disability data because of the reality of the vulnerability of persons with disabilities to COVID-19 and its accompanying effects on access to essential services. In our situation, COVID-19 came at a key moment when we were in the push to have reliable disability data, and just months after the 2019 Kenya National Census, where the Washington Group short set of questions had been applied. As an organization of persons with disabilities, we saw the great need to collect the data so that we understand the extent and dynamics of the pandemic and its effect on persons with disabilities, with the aim of developing appropriate advocacy strategies and messages. So what we did is we mobilized OPDs across the country to creatively bring together data from different sources to make the case for persons with disabilities, and some of the avenues included simple strategies like the WhatsApp group forums. And in this case, OPD leaders at the local level were the point persons in advocacy and awareness creation on the effects and concerns of persons with disabilities during the pandemic. So we created a WhatsApp group bringing together OPD leaders from across the country for experience sharing and for designing advocacy interventions. For example, OPD leaders were the key persons in identification of persons with disabilities as beneficiaries of the various social protection initiatives by government and other stakeholders. Through the various WhatsApp groups, platforms, we were able to get experiences on reach of the cash and food assistance, including issues with the selection of beneficiaries. One of the other things that we achieved was a WhatsApp group meeting with women with diverse disabilities. We were able to organize a focus group discussions for women with diverse disabilities. The restriction of movement and physical meetings due to the pandemic came at a point where, as part of the SDGs monitoring work in Kenya, was gathering data on the perspective of persons with disabilities in implementation of goals ahead of Kenya's voluntary national review that was scheduled. So this WhatsApp group was to administer an FGD, an online survey commissioned by the International Disability Alliance, and Jose talked about this, where views of women with diverse disabilities across the country were collected on how well women with disabilities are being involved in implementing SDGs, especially SDG on health, work, gender, and education. And a report was designed and developed and shared by IDA during the VNR. The other avenue that we used as an organization of persons with disabilities is SMS or text platform to collect the data. I talked of simple methods of data collection. So as the pandemic progressed, there was an upsurge in the demand for information on where to get support and assistance by persons with disabilities, and there was need to gather these experiences. So we set up this SMS platform that was linked to the office line where individuals could get information on services being provided and where to get them. And we were able to get real-time feedback on the first-hand experiences of persons with disabilities. This data was used to compile key messages and petitions on the greater need for inclusive interventions in regard to the COVID pandemic. We also did several online surveys, which became a key tool in gathering information on the situation and needs of persons with disabilities, which were disseminated through OPDs, such as on employment. UDPK took part in a number of these surveys, which were used to develop reports that informed advocacy. Webinars were also another method, and as an online conferencing platform became popular, we organized a number of webinars, bringing together persons with disabilities across the country to share their experiences and consolidate their voices, not just on the COVID situation, but also on other contemporary issues at the time, particularly the clamor to amend our national constitution. Now, how did we utilize this data for advocacy? Without face-to-face meetings, webinars presented a platform for engagement between duty bearers and OPDs, where lived experiences of persons with disabilities were shared, making the case for the need of disability inclusive and disability specific responses to the pandemic. A key achievement around this was being able to capitalize on the discussions around governance reforms in the country. Other key documents developed was the Advisory on Disability Inclusive COVID-19 Response, a statement on police brutality towards persons with disabilities in the implementation of the curfew measures, a memoranda to the Parliament on the Pandemic Response and Management Bill, and a petition for the prioritization of persons with disabilities in the vaccine rollout.
Anderson,
yes.
One minute.
Okay, so in conclusion, what I would say is that much effort still needs to go into ensuring that there is good disability data. There are still various gaps on getting disaggregated data, even on the numbers of persons with disabilities who have been vaccinated. We hope that the continued collaboration with key stakeholders will ensure that going forward, there is appropriate data. Thank you for listening to me.
Thank you, Anderson, and thank you for reminding us and giving so good examples of the importance of having data mobilization that it's led by persons with disabilities to address these issues in emergency context. Jennifer, I'm sorry for the delay in giving you the floor. Jennifer Madans, consultant on disability statistics from the Washington Group on Disability Statistics as well. Thank you, Jennifer, for your patience, and you have the floor.
Thank you so much, Facundo. And I think we've all gotten a lot of the presentations from my fellow panelists, which outline some new and innovative and I think very promising methods for obtaining data, not only on the general status of persons with disabilities, but also in particular on the impact of COVID, and then moving forward to how we might deal with other disasters that come our way in the future. But as also been mentioned, there remain real critical data gaps, not only regarding the impact of COVID on persons with disabilities and on a population that has been adversely affected by the pandemic. And this lack of information has really hampered efforts to address disparities that existed before and continue to exist. I think this lack of data reflects the pace at which disability indicators have been integrated into our country's core data systems. And by these, I mean the censuses and ongoing periodic surveys that governments rely on to track the status of their populations and the success of their policies and programs. And in addition, much of the data that has been used to monitor the impact of COVID has also come from these core data collections. And there has been a huge amount of progress in incorporating disability indicators into these surveys, and we've heard about that from the Pacific. in the Espoir region and in Africa. I mean, it has really been remarkable. But the pandemic has clearly demonstrated the impact of not gaining full adoption of these tools that allow us to identify the person with disability. And it's certainly heartening for me to hear about the way that the Washington groups have been adopted so far. But as we think about building back better, I think a greater focus on mainstreaming the collection of disability data is needed, and some of my other panelists have the same idea. When we do this, then we can do the basic disaggregation using the standard recommended Washington Group Disability Indicator. But I think it's also important to go beyond disaggregation. That is the necessary piece. But it's not sufficient to answer all our questions. We need to provide information on specific types or combinations of disabilities, examine intersectionality of disability with other characters such as age, gender, location, and of course the barriers and the facilitators that will improve inclusion. If all core data collections have the necessary information to identify the population with disability, then we would not only be able to continuously monitor the status of persons with disabilities, but will be in a much better prepared for the next disaster. Monitoring the impact of COVID has also required the collection of specific COVID-19 data items, for example, on vaccination or exposure. And some of these questions have been incorporated into the core ongoing data collection systems, but there also have been targeted COVID-19 data collections, and you've heard about some of them. It is really important that we be able to disaggregate the information obtained from these COVID-specific data collections in order to address equitable access to all that has been put in place to reduce the impact of the pandemic. The questions that identify the population with disabilities need to be added to these COVID-specific data collection. Now, there is also a need to go beyond the core surveys and censuses and start incorporating these questions into administrative data systems. And there's been a lot of work in this area, and more is needed. The education management information systems are being modified to allow for disaggregation, and that will provide a consistent source of information on learners with disability. There's also been a lot of work incorporating disability indicators in data collections in humanitarian crisis settings, and this is expanding, and of course is extremely challenging, but a failure to do it would make it impossible to meet the needs of persons with disabilities in these very unique kinds of situations. Now, this overriding need for timely data to monitor the pandemic has affected data quality in some cases, and I think we need to be aware of that. One of my particular concerns has been the lack of proper translation of questionnaires, and proper translation is absolutely essential to getting high quality data. Even if gold standard methods cannot be used, we need to incorporate processes that ensure that the data will be fit for use, and there are mechanisms to do that. The need to quickly put new data collections in place, particularly if you don't have information from your ongoing data collection, has also resulted in some hastily executed efforts to add disability indicators. And we find in some cases going back to old questions that we know produce poor quality data, just as like the single, do you have a disability question, or also going back to lists of medical conditions and impairments. Now, the need to reduce data collection burden and produce very timely data in light of a pandemic is absolutely real. But we really shouldn't use untested questions or questions known to produce poor quality data. They often don't reduce burden, but they will produce poor quality data. And also, to be sure, the lack of data is a reflection of the impact of the pandemic on the data collection processes themselves. All collection systems had to be adapted to the constraints of the pandemic, as you have heard. Many of the core data systems had to cease or pause their operations, especially at the beginning of the pandemic. And many in-person collections transition to phone or web-based interviewing to minimize risk and improve response rates. However, these changes impact data quality, especially representativenesses of data, and these impacts need to be evaluated and need to be documented so we understand how to use the data. Unfortunately, many of the new methods affected the participation of persons with disabilities more so than they affected the participations of others. If there is limited access to telephones or the web among persons with disabilities, as has been demonstrated in some cases, obviously the data will be lacking and will be biased. There are also some challenges with interviewing people with hearing or communication difficulties over the phone. And again, this will bias the data unless accommodations are made and put in place. Similarly, internet administration can present some challenges for persons with vision or cognition difficulties. And again, this will affect the representativeness of the data unless accessible web surveys are implemented. And this can be done, but it does take some effort. So what should we take forward from the current situation? What have we learned about data during COVID? And I think simply said, the tools are available to monitor how persons with disabilities have been and continue to be affected by COVID-19 for use in core ongoing surveys as well as targeted COVID-19 data collections. The Washington Group has a range of these tools and a lot of information on how to use them. If they are not used, then we will find ourselves in the same situation when the next pandemic hits or some other disaster hits. The disability indicators need to be part of ongoing core data collection systems that are used to monitor the well-being of populations, again, has been mentioned across all sectors, so that we will have the needed information now and next time. Disability indicators using the same methodology as we use for our core data system should be added to any new data collection, whether it's a survey or an administrative data system, so that we can respond as we respond to all changing data needs, and data needs do change. And finally, regarding data collection methods, the movement from in-person data collection to reliance on phone and web surveys, which I believe will continue even after COVID. We need to address any barriers to participation experienced by persons with disabilities so that they are also included in the data collection about them. Thanks very much.
Thank you very much, Jennifer. We're coming to the end of the session. We have only a couple of minutes, so we will not have time to give the floor for interventions. Nevertheless, we have a very interesting question on the taxonomy of the articles of the Convention on the Rights of Persons with Disabilities. In particular, so what are we talking about this? And hopefully we are interpreting you correctly. It's about the core functions or the core aspects of a right in the conventions, or the rights recognized in the convention, and how that can identify the possibility of looking at indicators to measuring advancements or challenges in human rights implementation. So I think it's very important to make this connection that many of the speakers have made in terms of looking at data collection in connection with the human rights that they are trying to protect. So it's very important to define what is the strategic objective in terms of human rights enjoyment, how that will translate into legislation and policy, how policy will trigger identification of indicators that will help us to guide data collection, and finally data collection as an exercise that is looking at ensuring the human rights of the population affected. So this is particularly key, and it's very important to look at what are the core elements of each right. We have facilitated this work in the Office of the High Commissioner for Human Rights through an SDG CRPD package. So it's a guiding tools that are looking at policy development and policy implementation to guide this process of connecting international policy with national policy policy, with human rights perspectives, with measurable indicators that can move the agenda both on measuring implementation and the agenda on measuring the impact on outcomes in that sense. And I think you will find that tool very, very useful in the work that you have ahead. We have a couple of more minutes to look at some other aspects, and maybe I can give very briefly for a minute or two the floor back to colleagues. There had been a couple of questions raised regarding the participation of women with disabilities in Kenya. So maybe we can go first to Anderson in terms of the engagement of women in the processes in Kenya. Anderson, you have the floor.
Thank you very much again. Fakado, yes, it's true that we realize that certain categories of persons with disabilities are being left behind. Even when you talk of the general disability, within issues of persons with disabilities, there are people who continue to be left behind, and we've been very particular in this, in ensuring that as we program, as we do advocacy, then we don't leave other people behind. So this is one of the reasons, because there are several surveys, and through the webinars that I talked about, we realized that women with disabilities in particular are very vulnerable to the COVID pandemic, and more so especially in terms of lost income and inability to do what they used to do in terms of their livelihoods, especially when the curfew came into being. So as an organization that does advocacy work, because that is what you do, it is to ensure that when we do this advocacy, it's not just general advocacy that just speaks of issues of persons with disabilities, but as we did these petitions, we went deeper into people with varying disabilities. People with psychosocial disabilities, people with intellectual disabilities, people who are blind, because their needs vary, and the mode of interventions also need to be in line with their needs. So this is why we specifically conducted that survey that targeted women with disabilities to also bring out their issues, and then use that in the kind of petitions that you came up with. Thank you.
Thank you very much, Anderson. The importance of intersectionality, right? And what is happening, not only to women and girls, but also to people that may have other multiple identities in that sense. I think I would like to thank Sophie Mitra that it's online for sharing the disability data report 2021. I think there is a lot of information that people may want to look at into that report, and thank you for sharing that. Also highlighting the efforts of the International Disability Alliance in the work that you've been doing in terms of consulting persons with disabilities directly, raising what are the priorities that are coming from persons with disabilities, and that the whole, both international and national systems can better prepare to work on issues that are of particular concerns to persons with disabilities themselves, and that are not coming from some more intellectual exercise, I would say, in that sense. We have still a couple of more minutes. We can try to give the floor to people that are present in the room in Bern. and see how we can make it work. Colleagues, perhaps if that's an option, we can try to give the floor. Okay, it seems to be that we do not have that option. Okay. I may, if I may, then I will go back to Neda. Neda, I think it would be interesting for you to share how you've been working into fostering partnerships, bringing national statistical offices and persons with disabilities to the table, and how that contributed a little bit to the work you've done. If you can jump on that specific question, that would be great.
Thank you very much. Yes, our work actually started just recently, but with the guidance of the Washington Group and other partners working on disability statistics, like the IDA and other important and the requests that came from countries and their interest in to collect data on disability statistics gave us the impetus to actually investigate the gaps if everybody is producing these data, although they're all interested in producing it, but are they all as per standards? And each gap we took it and assessed it and provided the guidelines to produce a better harmonized data. We also created different groups as we go, and wherever we find a challenge or a gap, we make a group. So it was the first interagency and expert group meeting, I think, in the world that we held with the statisticians, line ministries, NGOs, even our partners from the regional and global levels. And for the first time sat together on one table. And for the first time, we hear how and why not use the data that being produced. So in order to take all this into consideration in the next rounds and see what they need, what data should be produced. And now into our new initiative, because of COVID and the effect of COVID, especially on persons with disability, we found another challenge, a data gap. And we will be working again with our partners, expanding them to understand more what is needed to cover that part of information and bring about new guidelines or new tools for data collection. Thank you.
Thank you, Neda. Thank you very much. So we're coming then now to the closing of this session. I would like to thank all participants. It has to be super, super quick because we are less than a minute away. Thank you very much. I don't think we will have the time to go back to the panel on that question, but definitely extremely important to ensure the dissemination of information and access to data as it is established in Article 31 of the Convention. It's provided in accessible formats for all people, including the provision of reasonable accommodation when accessibility may not be fitting perhaps all needs in the programs that already exist to bridge that accessibility gap, right? Thank you very much, colleagues. We had over 100 participants through the whole meeting, and I think it was a very much a success. Thank you, Lisa and Gardina, for the sign interpretation. And thank you all colleagues for the organization of this event. We are closing the session. Thanks to the panelists as well. I look forward to seeing you all and to continue this conversation on data and the mobilization of resources for persons with disabilities to be better informed, to monitor better, and for policymakers to better plan for policy implementation. Thank you, colleagues, and see you next time.